So what are we about to do? So this is
I'm going to start an IV.
Okay.
So here, hold on to that. Yeah, good vein. Really good vein. You lift weights, huh?
That's right. Yeah.
All right. We're gonna
So are most of your patients that are coming in for this already healthy, or they're feeling
It's
a little
all
lousy?
over the map, and
Okay.
a lot of my patients aren't healthy. And some of my patients have cancer, prostate cancer. Okay, you ready? Here's the bad part.
Oh boy. That's good.
The worst is over.
All right.
I'm just going to tape it in.
How many years younger am I going to look after this trip? That's the key to this whole thing.
You're going to look like a child.
Look like a child. And so they come in, takes about 45 minutes.
Yeah, each bottle you'll see when we start doing the passes, each bottle is called a pass. And we're going to take some blood out. It's going to go up into this bottle. You'll see it going up the tubing now. Do a little squeezing of that ball. Now this is a solution, it's a blood thinner. It's called heparin. I dilute it with saline. And we have to put it in each bottle. Otherwise the blood would clot and I wouldn't be able to return the blood to you. So you get a little bit of heparin on each pass. I just put it into the syringe here. You don't feel it or anything.
So heparin is a blood thinner.
Yeah, but you have to be careful after getting a treatment because if you get injured or if you do a sport or any kind of activity where you could get injured, you could potentially
Just
bleed.
stay away from anything.
You could bleed a little more like a hemophiliac temporarily. It wears off in about 3-4 hours.
Okay.
But you wouldn't go to the boxing gym, don't do taekwondo, try not to fall down the stairs, things like that.
All right, all right.
But here we are, basically, we're just collecting blood. Randy has a tourniquet on his arm. He's squeezing this ball. The blood is going up. The machine here that this tubing is connected to creates a vacuum right here. And this is an automatic machine. This is actually one of the best ozone machines you can get. It comes from Germany. It creates a vacuum through this line. And the vacuum pressure allows the blood to come up into the bottle. And then you'll see after we fill the bottle about 3/4 of the way up, I reverse the process and the machine then will generate ozone. It's connected to oxygen right here. And from the oxygen, the machine generates ozone and then the ozone gets pumped through this tube into the bottle. And I swirl the blood, mix it with the gas, and then you get ozonated blood back into your body. And then we go back and forth.
And I may feel something while this is happening?
Yeah. A lot of people feel like their brain is more clear, they feel sharp, they feel energetic.
And it can be lasting. Like I may feel good for the next 3 months.
Yeah.
Possibly?
Yeah, it kind of tapers off. I mean, you'll feel the best this week. And then kind of the effect, but the effect of your immune system can last longer, but you may not feel that part.
Interesting.
So we're just waiting for the bottle to fill here. Now the thing about ozone is a natural gas. You've heard about the ozone layer.
Yeah.
And the ozone layer is a layer of gas that's way up high in the atmosphere and it actually protects the Earth. It protects the Earth from damaging solar rays and things like that. And then if you think about it, where does ozone come from naturally? Well, it comes from lightning cracking through the atmosphere and interacting with oxygen. And it cleaves off one of the oxygen molecules and it makes an unstable O3 from a stable O2. And that unstable one oxygen on the 3 is what's readily given off from the 3 because it's very unstable, and that's what causes all the effect in the body. So we're doing exactly what the lightning does in the atmosphere with the oxygen. We're pumping oxygen into this machine, and the machine sends electrons through the oxygen, creates ozone, it gets stored up in a chamber in the machine, and then we can pump that gas out and mix it with your blood.
No, there's a stem cell component to this. Is there or not?
So when we get up to 10 bottles, because you'll see we can go back and forth multiple times and fill multiple bottles, When we get up to 8 to 10 bottles, and this is what this Dr. Lahadny developed in Austria, he found that at that level, you can start to mobilize your stem cells from your bone marrow. And that's where we see, I'm going to start giving this back to you now.
Okay.
So I'm going to open the tourniquet. You can relax your hand here.
Okay.
And now I'm going to start pumping gas into the bottle. Now the machine is pumping gas into the bottle, and the blood is now going back to Randy, reversing the process. But he's getting back now his blood that's being mixed with ozone.
So you have to shake it a little bit.
You have to mix
Is that
it.
why you mix
Yeah,
it? Okay.
we have to mix it so that the gas gets into the blood cells. And if you notice, his blood starts out kind of dark. That's normal venous blood. And when we saturate it with oxygen and ozone, it should get brighter and brighter red.
Okay.
And we'll know over bottle after bottle, it'll start to show that.